Good afternoon or morning, depending on where you may be in this country, and welcome to a special edition of our Center for Practice Excellence Speaker Series event. We are in store for a very interesting, interactive, and lively afternoon with our guests and our panelists. And with no further ado, please let me hand over proceedings to our moderator for today's event, Annalise Mathers. Over to you, Annalise.
Thanks, Zubin, and welcome to everyone who's joining us. This feels like a very fitting event, especially at the beginning of March with Pharmacist Awareness Month. So I'm very excited to host Danielle Paes and Kevin today for our CPhA speaker series. Just before we get started, I'd just like to start our session today with an acknowledgement of the land that I'm on today here at the University of Toronto. For thousands of years, this has been the traditional land of the Huron-Wendat, the Seneca, and the Mississaugas of the Credit. Today, this meeting place is still home to many Indigenous people from across Turtle Island, and we're very grateful to have the opportunity to work on this land. For my own path to truth and reconciliation, I personally have benefited as a settler from living on this land in Treaty 13 here in Toronto, as well as through my education and training on the land in Ottawa and British Columbia. I'm grateful to work towards a deeper understanding of the history that has brought myself and all of us on this call today to reside on this land and to work towards creating environments of mutual respect and learning. So for our event today, we're going to begin with a brief presentation by Danielle, who's then going to pose some questions and remarks to Shams and Kevin. So we'll have a really engaging and thought-provoking discussion on kind of our pharmacy workforce, where we've been, where we are now, and where we're going. And then we'll save the remaining balance, 15 minutes, 20 minutes or so, for audience question and answer, which we typically do at the end of our session. So I'll just ask people can keep themselves on mute if they don't mind, and put any questions and comments into the chat, and we'll get to questions at the end of our event today. I will say Danielle has welcomed people to turn on their videos if people are comfortable to do so, just so we can kind of boost engagement that way, but whatever people are comfortable with. So without further ado, I'd just like to introduce our speakers for today. Danielle, I'll start with you. So Danielle is the Chief Pharmacist Officer at the Canadian Pharmacists Association, or CPhA, where she's driving strategic efforts in the areas of engagement, diversity and inclusion, and pharmacist mental health and wellness. She holds bachelor and doctor of pharmacy degrees from the University of Waterloo and a bachelor of science in applied pharmaceutical chemistry from the University of Guelph. Danielle brings a wealth of experience to her role at CPhA, and her unique portfolio gives her a pan-Canadian view into the needs and perspectives of pharmacists across Canada. Most recently, she's practiced as a clinical pharmacist at Hull and Bloorview Kids Rehabilitation Hospital in Toronto, and has held previous roles in community pharmacy, industry, and academia. Danielle is recognized as a dynamic and forward-thinking pharmacist committed to advancing the profession, engaging and supporting frontline pharmacists, and advocating for effective use of our Canadian healthcare system to help optimize patient care. And I think that in a nutshell is what our session is about today. Shams, I'd like to introduce you next. Shams is a full-time pharmacist at Shoppers Drug Mart and has recently graduated from the International Pharmacy Graduate, or IPG, bridging program at the University of Toronto. She also has a PharmD from the University of Jordan. Shams has many certifications, and her bio always blows my mind a little bit, but she's a certified clinical researcher, entrepreneur, and web and phone applications developer. Due to her passion for technology, she was able to create the RX Course Institute Inc. platform in pharmacy education. Shams has an ultimate goal to ease the path for internationally trained pharmacists to get a foothold in the Canadian healthcare system, to replace the journey of licensure from broken hearts and shattered dreams to success, happiness, and joy of their achievements. And Kevin, last but not least, Kevin is a pharmacy graduate of Dalhousie University with 20 years experience in various practice environments across Canada and internationally. He is currently the Director of Professional Practice for the New Brunswick Pharmacists Association and a community pharmacist supporting expanded scopes of practice. He's a past CPhA National President and an outgoing Board of Director on the New Brunswick Pharmacists Association. Currently, he's a steering committee member on Canada's Pharmacy Workforce Planning Committee and sits on CPhA's Mental Health and Wellness Task Force. I couldn't think of a better group to have this conversation today. Danielle, I'd like to pass it over to you to get us started. Thank you, everyone.
Okay, can everyone see my screen? I can't see you, so I'm just gonna assume that that's a yes. So I'm really excited to be here today and to have this conversation. It's Pharmacy Appreciation Month, and we have so much to celebrate, but we also have to talk about the realities that we're facing and the consequences of being such key players in our healthcare arena, and what that's the unintended consequences of that. So the topic today is from surviving to thriving in the current state of pharmacy workforce wellness and where we go from here. And I need to figure out how to advance my slides. Oh no, I'm having technical difficulties already. Let's see. Oh, there we go. Okay. So we'll start with a quote. So life throws challenges, but with patience and resilience, you can convert every challenge into a new opportunity to grow. And I'm starting with a quote because, and I'm putting the timer on, so I talk too much. I'm starting with a quote because I want to frame this conversation. Yes, there are a lot of challenges, and yes, we have to talk about the realities that we're currently facing. But from those challenges, I'd like to focus on the opportunities that exist to make things better. So way back, playback, this is just a grounding display of where we were in 2010. So that was like 13 years ago. Don't look at the details of it, just look at all the number of X's. There's a lot of red X's on this chart, and it really just speaks to the fact that we've come a long way. You know, the things that are included here are making therapeutic substitutions, changing drug dosage forms. Like, there are things that have X's on them that don't make sense for medication experts to not be authorized to do. And so you think about the environment that we've been functioning in historically, almost operating in the realm of medication management with handcuffs on. And so, you know, the pandemic has really changed that for us. In so many ways, it's accelerated the visibility people have in terms of what we are capable of adding to healthcare, and how we can use our knowledge and our skills to support our communities and our patients within the context of their evolving needs. And this is you know, the pandemic has in many ways put a spotlight on us. And I know we keep saying that, but the truth is it's actually resulted in this expansion. And we've seen how much change we've experienced over the last year and a half, 2 years, and the number of blue check marks. So not only are we seeing more authorities, but the nuance and the details and the depth and the level of what we're getting involved in is growing. And it's not happening evenly. You know, every time I look at this chart, I cringe a little at the number of red X's in our northern territories. It's completely glaringly obvious that we have inequity and disparities for our rural, like northern and rural communities. And that's something that I think we need to work towards improving. But ideally, we're seeing that the trajectories that we're moving forward, and we're starting to see that transition to take the handcuffs off and allow us to practice using full scope. So last year, around this time, we did a workforce wellness study to get a pulse on where people were at. You know, we had heard anecdotally that things were rough, but we needed some data to back that up. So this data is a year old. We actually have just launched the wellness survey for 2023. I have it here on the slide here, www.pharmacist.ca/PWW. If you haven't had a chance to do it already, please do it. This data is so important for us to get a sense of where we're at. You know, how much of the results that I'm about to show you was related to the period of time that we took that data in, which was around Omicron. So how much of it was related to the pandemic, and how much of it is actually continuing today, knowing that the variables have changed, knowing that the factors have evolved over the course of the year. So if you have a moment, should be 15 minutes, but I just want to put a plug in because that data is going to feed into the work that we're doing. So here is a general overview of where we are at. So 4 in 10 pharmacists report their mental health as being not good or poor. And if you think about it, that's a huge number of our colleagues that are functioning with the self-acknowledgement that they're not in a good mental space. And we can analyze this which way or any which way or the other, like what is causing this. And it could be a number of factors because we don't just function as pharmacists. We are mothers and fathers and caregivers, and we have personal lives, and we have so many other influences that might influence where we are at any given moment in terms of our mental health and wellness. But what was really interesting, we wanted to know how much of your work is impacting your mental health, or how much does work impact your mental health? And 8 in 10 said their work has negatively impacted their mental state. And so if you think about that, we know that the direct impact of working in a pharmacy is negative, arguably. And I'm stating these numbers, but it's really just to give you a trend and give an idea of what people are dealing with. So we talk about burnout, and this is the Oldenburg burnout inventory. And this is just to give you another measure in case you needed the data. As pharmacists, we're very scientific. So 92% of pharmacists or pharmacy professionals are at risk of burnout. And when you compare that to the average working Canadian, so, arguably everybody was impacted by the pandemic, but compared to an average working Canadian, if you were working in a pharmacy setting, you were 23% more likely to be suffering risk or at risk of burnout, which is a significant consideration when you think about the fact that we're still living through the pandemic. And I don't know how much of that pressure has really let up. It'll be interesting to see the results of this year's survey, but just to give you an idea of what when you're not in burnout, what that sounds like. So I find my work to be a positive challenge, and I feel energized by my work. And maybe some of us do, and maybe some of us have experienced that at some point in our career, but the indicators are showing that it's more than likely that we're at a point where we're doing our job mechanically and we feel emotionally drained after work. And so those are the types of comments that, or you can sort of reflect on yourself. How does your work make you feel? So what is contributing to the specifics around work's negative impact? So increased workload during work hours, inadequate staffing. We've seen that there's been not just in pharmacy, but in the healthcare workforce in general. We just don't have enough people, not only pharmacists, but pharmacy technicians, pharmacy assistants. We need the support staff as well. Long working hours and lack of work-life balance. These are issues that predated the pandemic, but a lot of what we're finding is that we know what the issues are. We just need to figure out how we tackle them. So abuse and harassment, this is something that pharmacy professionals have lived with for a long time. You are the face of insurance. You're the face of, prescriber decisions. Physicians and nurse practitioners may have made a call and you're delivering the message. So as the delivery person, as the messenger, inevitably you also are the recipient of less than ideal feedback from patients in some circumstances. And so this concept of the abuse and harassment and within the context of the pandemic, when people are just even more stressed and they're coming to you very vulnerable, it's there's a burden to that, right? And there's an impact that that has. And it results in people considering leaving their job. So 40% of the respondents for this survey said that they had thought about leaving their job. Even worse than that is this concept of leaving the profession altogether. So not only have these pressures resulted in people considering leaving their immediate role, but leaving pharmacy. And knowing we're already in a bit of a workforce crisis, health resources are limited, we can't afford to lose anybody, because that's just going to add more pressure. And so that's where we're at. That being said, I want to quickly touch on this concept of mental health and understanding how we, as you know, the pharmacy culture speaks and embraces the idea of self-care and looking after one's mental health and well-being. So 1 in 5 people say that their mental health isn't okay, and they don't feel comfortable seeking support from their employer. So that's a problem. So you're able to recognize that you need help, but you're not comfortable seeking the help. And so I wonder how much of that is the culture that we have as clinicians, as healthcare providers, you know, this idea that people come to us when they need help. We're sort of the last in line for accessing care. And there's probably a lot of psychology involved, but something for us to think about and really just challenge, quite truthfully. And then this last one is around awareness of the resources that are available. And the results really show that it's one thing to acknowledge that you need the supports, but what supports are available, who is offering them, and accessing that's that next level. And I think we have some work to do in terms of raising awareness about what's available, and who you might be able to reach out to. So I kind of get the idea of not wanting to seek support from your employer, just to protect your privacy. But there are other alternatives. There are other organizations that can offer support, and it can be anonymous. And so we want to identify what those barriers are and decrease them wherever we can, so that the people that need the help can access it, and access it without fear that there might be consequences. So in summary, I wanted to only spend 10 minutes on this because there's lots of time for discussion, but we know that the pandemic has worsened a challenging environment for pharmacists. We're almost all at risk of burnout. We know that mental health supports are needed, as well as this shift in pharmacy culture to support well-being. We know that pharmacy can expect ongoing workforce issues, staff turnover, and these challenges with recruitment and retention are something we're going to be talking about for years ahead of us. How do we support our international pharmacy graduates? How do we support our students? How do we build a sustainable workforce that is not just surviving, but thriving? So this idea of safe, healthy work environments, it's all long overdue. And lastly, we need pharmacy champions, and we need leaders in healthcare to allow us to transition into that preferred state. So I'm going to stop sharing there. I know that's a lot to digest. There's a lot of information there. I guess we're going to start. My first question is really to Shams and Kevin. Thank you for joining us. I want to know, how do you feel about those results? Did anything jump out at you? Did anything surprise you? Do these results reflect what you've seen and or lived through personally?
Shams, do you want to start?
Well, thank you so much for having me, and thank you so much, Danielle. It was a very enlightening presentation, and I think the most one that jumped into me, which is the feeling of, going into your employer and delivering the message that, hey, I'm not feeling okay. Hey, I need support in here, which is correlates to a stigma probably, and there is this fear that probably if I'm gonna speak up about the current condition that I am right now in, I may lose my job. I may lose the shifts that I have. I may be moved from a full-time pharmacist to a part-time pharmacist or just weekends pharmacist. Who knows? So that is a very, very important factor. And they have seen many pharmacists who they would just be silent about it. Like whatever they see, whatever they have issues, or just silent, like I'm so scared. Like I don't want to open up, but I'm so scared. I don't want anyone to know that I am facing some challenges. So I think that's the most important thing, which goes back and circle back to the finishing statement when you said we need support from employers, from pharmacy managers, from pharmacy associates into opening it up and help us, to take out the stigma that it's okay, it's okay. It's a safe environment. I think that is the most important point. To you, Kevin.
Thanks. Every time I hear this data, it strikes me a different way. I'm not surprised at all at the data, having worked in community, especially in the last, since the pandemic for sure. But the pandemic, I think, has exposed cracks that already existed in some of the foundations of pharmacy. They've just accentuated problems that have been there. So the 92% stat of their rate of burnout of pharmacists at or near burnout, I think it's 40 or 50% would describe their wellness as mentally well. 75% have considered leaving the profession altogether. Very staggering numbers. This time when I heard the presentation, the quote, "I find my work to be a positive challenge," 45% agree. "When I work, I usually feel energized," 33% agree. So that's our call to action. I'll talk about that maybe in a little bit, but I think that's where we start. I think we are at a crossroads in our profession where we have come through a difficult period. We recognize that we're resilient. At the same time, the profession is changing very quickly because the public demands it, because of the issues with access to healthcare. Pharmacists are being put in more roles. Pharmacy technicians are being put in new roles. So the pressures are there. We have to learn how to triage information, how to adapt, and how to move forward. We'll do that.
Thank you. And we know there's so many factors that contribute to this current state: job satisfaction, our relationship with our evolving role. Like those are all indicators that we need to pay attention to. And these new expectations that the public has of us, of who we are and what we can do for them, that adds another layer of complexity to it. Pandemic aside, long work hours, lack of work-life balance, drug shortages, inadequate remuneration, abuse, harassment, that was all part of the picture before the pandemic. So at baseline, pharmacies have the potential to be very stressful environments to operate in. And we've been operating in survival mode for a long time. So we're going to focus our discussion towards that future state and that vision of a thriving profession. So where do we start? And I've been thinking, like, where do we even begin? And I think a logical place to start is looking at ourselves. So as individual professionals, pharmacists, knowing that, we've heard that analogy, classic airplane and oxygen mask analogy. You need to place it on yourself before you can help anyone else. So with this in mind, and knowing that there's so much happening that is completely outside of our control, what are your thoughts and or strategies on how we can take care of ourselves, protect ourselves, and remain resilient in these challenging environments that we continue to find ourselves in? I'll turn it over to Kevin first.
So again, those 2 points, the first quote, "I find my work to be a positive challenge," 45% of the respondents to the mental health and wellness survey agreed with that. The second quote, "When I work, I usually feel energized," 33% of respondents agree with that. I think that's where we start. I think we start by focusing on ourselves, on the individual. And at the community pharmacy level or wherever you are, whatever your organization is, I think to go from survival mode to thriving mode, I think we start by having very candid conversations. We share the data that we're sharing together today with our teams, and we talk about it. We say, well, what does this mean? How is this impacting me? Because it starts at the individual level. The change in the profession of pharmacy moving forward starts with a change in how we see ourselves in the profession. You mentioned in the question, there's so much happening outside of our control. So that sense of helplessness, of not having control, is what causes a lot of the anxiety. So what if our messaging isn't, we're out of control, we're overworked? What if it's quotes like are also in the survey? What harm would happen if the messaging I repeatedly told myself is, when I work, I usually feel energized. Helping patients feels good. If I reverse the quotes in the 45%, what if we say those things to ourselves all the time? I usually feel energized in the workplace. Those conversations are where we start. And then we start with taking care of ourselves. And I know this is not a new situation, but we can't give what we don't have. We have to take breaks. We have to take lunches. We have to have balance within our workplace. We have to be able to feel comfortable in the workplace to talk about our mental health and our wellness, to talk about periods of anxiousness and depression, to have places to go when things aren't going the way that we need them to go. Because when you're down, everything is harder. So to prevent that in the first place, we have to take care of ourselves outside the workplace. So whether it be a faith, meditation, wellness acts, all those things help fill your tank. For myself in my own life, people know that I have anxiety and depression. It's something that I focus on every day. Every day you have to fill up your own tank in life. You can't give it all to the patients because you can't pour from an empty cup. So eating right, sleeping right, physical activity, getting outdoors, getting those natural endorphins pumping when you're outside of your work time. For me, I have a dog. The dog is great. He keeps me active. He motivates me. You have your families, same sort of situation. The gym, physical activity, exercise, sport, community, those sorts of things are what we need to do, because our profession is something that's very important to us, but it's not all of us. So when I hear the things that are coming out in these surveys that say 43% of the people feel like they're energized at work, we've fought and worked for many years to get into pharmacy. This cannot be the outcome of our profession. We have to dig in to reanalyze, take care of ourselves and take care of each other, just by reminding ourselves of what are the basic things that I need to do to fill my bank in life each day. It comes down to Maslow's hierarchy of needs. Just do the basics first, and it will help you care better for your patients by caring for yourself.
Sham, do you have anything to add?
Yeah, well, Kevin, you have been amazing. Oh my God, that's amazing. The idea of, taking breaks, and it's like when we think of a human body, of a person, you have three parts: your mind, your body, and your soul. And this is one thing that is lacking, especially if you're taking like 12 hours, 13-hour shift. I mean, isn't it right for me, to feed my body? Like, I need to sit down for 5-10 minutes and have a decent meal at least. I was living on protein bars. So that's number one. Number two, as you said, about some of people have like meditation. That is their relief. For me, for example, praying, that is my relief. But when you take that out of me, and I start to think like, am I in the right place or not? Probably I would go into a place that would allow me for these 5 minutes for me to pray, for example. So that is very, very important point. And I keep wondering why up till this moment, we don't have just a decent break for pharmacists. So the other thing about taking care of ourselves, I think, which is something would be very helpful, is building relations. This is something that I found it very, very rewarding, which is there's this notion that I am here to take my shift and go home. don't know, like I strongly have a very strong disbelief in that. I love to make a relationship with every single person in the pharmacy and meeting outside of the pharmacy, discussing things, discussing even family matters, discussing, as we're saying, the mental status that we are in. When we start with a friendship, let's say, opportunity with every single person in the pharmacy, you will automatically open up. You will automatically find someone that you can lean on, someone that you trust. And when you have this group of people that you make as your family, that would definitely help you so much, into thriving. Part 3, if you're gonna think of another rewarding thing that can help you sometimes, which is the patients, making relationships with the patients. I know, like, out of the ethical point of view, but I'm talking about having the best way and the best methodologies for our patients to be as satisfied as they can, which is something we always need to consider and acknowledge. Our patients come from very different backgrounds. Some of them, they don't speak English. So how am I going to cope with that? How am I going to draw a smile on my patient's face while he's he's fighting to get a word or two about his prescription? So as Kevin said, you can turn the computer screen and open Google Translate and can translate everything. That could be one thing. What if my patient has a disability? He's not able to hear me well. Well, I have this little pad that I have inside me, and we can grow together and we can discuss the prescriptions with them. I even went into another level that I learned some sort of a sign language, which is very fun, by the way. But you can do it when you surprise your deaf patients that some moves in the sign language. That would be amazing. It is rewarding. It will come back to you when you see your patient thanking you and coming back to thank you again. This is by itself is rewarding. You will, automatically forget these 6-7 hours that you have been running through all the day just because of that smile or because of that little gift or because of that big thank you and appreciation. So yeah, make relations, love each other. That's one thing. And one last thing, I don't want to forget about that. No matter how you look, no matter where you come from, okay, always have this big, huge confidence that you are a healthcare professional, you are a pharmacist, you are a gym, okay, in the community. And no matter what happens in front of you, nothing is personal and nothing has nothing to do from where you are or how you look. Always approach things into a positive manner and they will turn out positively. To you.
I love that. I think both of you touched on the importance of mindset and how you frame things, and also thanks, Sham, for the reminder that our days can be filled with magical moments, because I think we've all experienced those powerful moments with our patients where you can see the impact that you're having and how rewarding that can be. So let's build on this vision and talk and move from caring for oneself to caring for each other. One of the things that I often think about is the value of building strong pharmacy teams. And, I've been very deliberate personally about the environments that I choose to work in. So wherever I go, I make a conscious effort to try to find the fun and the humor in the work that I'm doing and to connect with my colleagues. Pharmacies are stressful places, and I want to be able to lean on my team and rely on them. That said, I in saying these, I realize that I'm coming from a place of privilege. So English is my first language. I have a name that most people can pronounce. I was trained in Canada. So there are a lot of factors that are likely contributing to my own comfort and that allow me to easily connect with my peers. We've talked a lot. I mean, diversity, equity, and inclusion. These are really, really important conversations that we need to unpack the concepts of learning and unlearning and the goal of making pharmacy spaces safe and healthy and welcoming. So my next question, and I love Shams, if you can kick us off. So recognizing that there isn't a single one size fits all template that can be applied to every pharmacy environment, what can you do, or what can we do as individuals to support each other? How do we create effective teams? How do we as individuals have a positive influence on the places that we work?
Well, as you said, Danielle, regarding the language, I mean, we're so powerful. Canada's so powerful with its diversity, and we need to embrace that. It is an amazing thing. This is one of the first things that I have noticed when I first immigrated. I was like, standing in the pharmacy, and we have like 5 or 6 people speaking different languages, and whoever patient would come in, like, hey, he speaks, for example, Mandarin, or he speaks Punjabi, or he speaks Arabic, or everyone will I'll take over, which is amazing. So as much as we embrace diversity, that is it is definitely a sort of thriving in the pharmacy. So that would be number one. Number two, as I said, embracing the differences and embracing the inequalities, especially with the patients and other people. These things are part of appreciation. When you go into that other level, just another level, into making it easier, into making it more accessible, into making it more fun, more enjoyable, and into providing it into different aspects. For example, a simple meeting in the pharmacy, just a simple meeting in the pharmacy, we're having breakfast. It is amazing when you have a manager who is acknowledging every single member in the pharmacy. Some of them are vegan, some of them only eat halal. It is these little tiny things that make you thrive and make you rise. So, and you get appreciation. And when you get this, you feel this appreciation inside you toward your manager, you automatically want to deliver that back. We definitely, if we are empty from the inside, we cannot give. So we need that. And we need to think about the higher level, going down, from the management level, from the owners. How are they treating their pharmacy managers? The more that you are rewarding them, the more that you're making them happy, the more that you are listening to the issues, the more that we touch base with each other, you're automatically going to your pharmacy team. Your staff pharmacist is in a better situation. Your staff pharmacist has someone to listen to, has someone to hear from, has someone to lean on, as you said. That would automatically goes to your patients. When your patient, even though regarding diversity, patients love us being diverse. When you're a patient coming from a specific background, no matter how we're going to speak about it, but they will have this sort of connection when they see a member of the pharmacy team from their society or from their culture. They feel like this person's going to understand me. So we need to embrace that. Embracing that beauty is just like, our boost for thriving.
Thank you, Kevin. What are your thoughts?
Yes. Paying attention to the time, I'm also looking at these chat questions over on the side. There's so much that we can do to enhance the teams that we have in pharmacies. The first thing that we try to do with the team that I'm involved with is, no matter what your position is, whether you're a higher echelon position or a lower echelon position, we're all equal. We're all doing an important part of the job that gets the medication to the patient. And without each one of us, things don't operate the way that they need to operate. So we treat each other with respect and equalness. That respect and equalness means that sometimes we have to have difficult conversations. Whenever you have people that are in a stressful environment, whenever you have people, period, we have to learn how to communicate with each other, how to diffuse situations early on so that they don't get to a place that isn't healthy in the workforce. We also just have to recognize each other as people. So in our strengths and in our weaknesses, we have to support each other always, always, always in front of the patient. We never have disagreements in front of the patient, even if it comes to a situation where we feel our judgment is not the same as a colleague's. We support each other all the time. We grow together towards each other. We celebrate successes. We show gratitude. We have a positive attitude in the workplace. We try to start out the day saying this day is going to be a better day, and starting it out that way usually means that the day will go better than it would have if you started out thinking that things are so bad right now. So I think those are the additional things that I would say on top of what Shams has offered.
That's awesome. Okay, so we've got lots of audience questions. So I'm going to quickly turn our attention towards future of pharmacy. We can safely assume that as the role of pharmacist continues to evolve, so will the expectations. We're being incorporated into the federal government's plan for healthcare transformation in Canada. And so we're going to be called to support primary care in our communities and to fully utilize our training as medication experts. So knowing this, I want to talk about the sustainability of our workforce and the fact that people are leaving. Pharmacists are looking for alternative roles and in some cases walking away. So this idea of career growth and evolution, I think that's natural. I think that's healthy. I'm concerned that the movement and the shifts that we're seeing within pharmacy is a reflection of the unsustainable nature of our current practice settings, and it's rooted in self-preservation versus growth. So if you could quickly, before we open it up to audience questions, tell me a little bit about how do we enhance morale? How do we increase job satisfaction? How do we reignite the passion for the profession to ensure that we have a thriving workforce into the future?
Yeah, so this is a tough one. Time for some tough love. I think that we stop looking for fulfillment from other people and we start to look at what fulfills us as a professional, whether we're a pharmacist or a technician. What is it that drives us? We can't look to others for our own happiness. So, in the survey it talked about figure out what contributes to your fulfillment, the ability to practice to full scope, the ability to have patient care, professional autonomy, being part of a team. Whatever it is that fills you up, focus on that. So for example, for me, it's my ability to make a connection with the patient. I have worked from Tofino in British Columbia to Charlottetown in Prince Edward Island. I've worked in Australia. I've worked in Florida. I've worked in downtown Metro Toronto. I've worked with patients with HIV. I've worked with patients with mental health problems, patients with addictions. At the end of the day, people want you to see them as human before you see them as a patient. If you focus on the people that you deal with each day as human beings, you will get fulfillment. And that will change everything. The second way that you can do it is, again, to be frank, stop looking at the profession for what it can do for you and try to figure out how you can contribute back to the profession. So expansion of roles is happening. There are all the problems with billing numbers. Are we getting remunerated? What's your contribution? What are you doing on a daily basis that can make the situation better? There's lots of us out there that are working in very difficult situations where we might not have time to do it, but we have to make the time for things to get better. Supporting each other, being involved in your professional volunteer associations, and finding out what makes you fulfilled and not stopping until you get there, I think are things that are going to change the trajectory from surviving to thriving as a profession.
Should we turn it over to audience questions, maybe? Annalise?
Yeah, sure. Shams, do you want to weigh in on that last question, or happy if you'd like to add anything before we take a look in the chat, because there's lots happening there too.
No, we can go over.
Okay. So yeah, I think Danielle, such a great last question, because I think a few things in the chat have sort of emerged to me in just this conversation. I think starting a few minutes ago with Lindsay's comment, which I found really interesting about advocating for pharmacists to have their own billing numbers to improve the overall morale of the profession, and also help move pharmacists into the clinical roles they're trained to do. I thought that was a really interesting point and not necessarily one I've heard before. So I was curious if Shams or Kevin, you had thoughts on that, or if that's come across your table before.
I have so many thoughts about it. This is exactly where we're at as a profession. We're trying to get the right people in the right positions so that we can maximize all of our abilities. So that means getting enough pharmacy technicians. That means getting pharmacy technicians that are able to practice to their full scope so that pharmacists can do the patient care activities that they are trained to do, so that we can all work together to give Canadians better access to healthcare using the skills and knowledge that we have. It's a perfect storm right now. We're working on scopes of practice. We're working on remuneration. We're working on HR. We're working on relationships between colleges and associations and government, and it will all happen. The one risk that I see that each of the provinces has right now is if we are fearful to go forward because we think that we're not getting paid for it yet. I know we have to get paid for our services. I know that very well, but if sometimes we have to put the service first in order to get the remuneration, and it does become difficult. So during those difficult times, that's when it's time to start advocating, when you start to join your professional organizations, to voice your concerns so that you can have a healthy outlet to the feelings that you're having, and we can move forward instead of just working through the profession and feeling frustrated each day in the workplace.
I have thoughts because I think it's linked to autonomy, and I think autonomy plays a really big part in our relationship with the work that we're doing. And I've always found it really challenging. You know, I used to do COVID-19 vaccination clinics and or flu shots. Whether or not I did one injection or 60 injections, I get compensated the same way, which I think that we really need to look at the way that we are our funding models and how it there's just some, you talk about inequities. It's not fair in many respects, and I think that feeds into that helplessness and that feeling that it doesn't matter what you do. You could show up and just stand there, and you could put your best foot forward and do the best you can. And I think we're at a state where we can't just rely on the good faith of pharmacy professionals to do the right thing. Like, we really do need to make it sustainable, because we're all trying to survive in this world as well. We have families and mortgages, and it's not easy. The cost, you talk about the cost of living. Like, we really need to think about how we set up our pharmacy models in a way that promotes sustainability of our health workforce.
Yeah. Kevin, do you want to add to that?
No, said it.
Okay.
I agree. It's part of the life that I live and work. I can hear all my colleagues saying, for God's sakes, Kevin, make sure you tell them that I gave 4,000 flu shots and COVID shots and I didn't get paid a dime more. So you can do all these things for the good of the patient all you want, but you're still tired at the end of the day, and we do deserve to be remunerated for it. I completely agree.
Yeah, that's fantastic. Thank you. Thank you both for commenting on that. Shams, I wanted to get your thought maybe on a larger part of the conversation that's sort of gone on in the chat, just given some of your remarks during today's session about camaraderie at work and interactions with pharmacists, pharmacy technicians, pharmacy assistants who you work directly with. And just getting some thoughts. I mean, I might be pronouncing your name wrong. I'm sorry if I am. Commented that part of the challenge is that community pharmacists particularly operate in very siloed practices, and was having a bit of a discussion about how to more establish that sense of camaraderie in the pharmacy. I think the conversation sort of floated around in maybe a messaging app, but just wanted to get your thoughts on that, and given your experiences in that field, if there are things that are being done that could be really helpful, or any advice you might have.
Yeah, thank you so much for that. For May, thank you so much for the question as well. it is actually very helpful. Like I remember myself when I've just started, and I was calling all my friends who have been as community pharmacists, and everything that I face, I keep asking them like, hey, how would you do that, for example? Or I had like this issue today. If you were me, how would you proceed with that? So having like a support group is crucial in our practice. And I totally agree that every single one of us should have at least like 5 pharmacists surrounding him, supporting him. They don't need to be under the same pharmacy. They can be in different locations, in different pharmacies, so we can maintain the relationship. Now, what are my thoughts? Like how do we have those pharmacists? Like how can I build these relations? Number one, let's start with the pharmacist within your area or within your pharmacy. I personally remember myself on my first shift, I got the names of the pharmacists working there and I introduced myself to them. And I was like, hey, I want to get to know you. Let's have a cup of coffee someday. This is number one. So like the people around us, this is number one. Number two, my colleague, for example, me as an international pharmacy graduate, when I was doing my licensure exams, I bumped into different people, especially in the library when we were studying, and they became like a long life friends for me. And right now, they are my references as pharmacists. Number three, always keep the bridges, never burn bridges behind you, which is very, very important. Because I have pharmacists who I have been working for as an assistant, as a student, and right now they are my references. They are much older than me. They have a huge experience of like 20 and 30 years. So embrace them. Like, whenever you see a pharmacist, try to be as friends as possible with that pharmacist, exchanging gifts, inviting each other on lunch or dinner. It is very important. Now, what about the tools that are available? We have groups, by the way, like on Facebook and on LinkedIn, there are pharmacist group and so on. And number two, if you go to LinkedIn, for example, and type in like just pharmacist, okay, and you select the location to be someone who is surrounded by you, like let's say you're living in Waterloo, just choose Waterloo. So automatically you will have like a list of pharmacists who are living there, and then you can connect with each one of them individually and make these relations. And when you connect, you don't know, like most of the time, as I met Danielle, for example, we met over LinkedIn, and here we are after a year. we're friends right now. So the same thing with other pharmacists. Never get afraid. We pharmacists love communication. We're social people. So embrace that and enjoy it. It is part of our success, and it is really good when you have a peer beside you, regardless of seniority level. You have a peer that has nothing to do with your pharmacy, has nothing to do with the environment you are in. He's living into totally different place, into a totally different practice, totally different pharmacy. He has another fresh point of view. So yeah, there are a lot of opportunities and venues for that.
Yeah, thank you so much, Shams. I think you raised so many good points, and I think that's sort of the beauty of today's conversation, is just getting to share some of those stories and the apps and various things that are being shared in the chat, so that we can all make the profession a little bit closer and more friendly, as you've said. I thank everyone for weighing in the chat. That's been fantastic. I think I'll push it back to Danielle. I know you have a few more comments before you and Kevin, before we wrap up. So yeah, thank you so much.
Yeah, oh my gosh, I feel like this whole conversation could keep going for another half an hour, but the idea of connecting us together, like we are so much stronger together. And I always think about, I would love to poll the audience on this, and imagine if you could just like ask 100 pharmacists what they would do in this situation. It'd be just, it's cool, because what we do as professionals is we navigate the gray, we navigate the unknown. It's not black and white, and in an information saturated time where evidence is evolving and moving around, it's hard to know what to do at any given moment, and all the factors that influence a decision. So anyways, this idea of bringing pharmacists together is very much in the spirit of our success, I think. So I'm gonna actually share my screen. Actually, should I share my screen? Yeah, I'm gonna share my screen. Really quickly, hang on. I just have a couple of reflection questions for those that are listening here. So how is your mental health and well-being impacting your career? That's for you to walk away with and think about. What strategies have you tried to support your own personal and professional wellness? And how are you supporting your professional growth and development? What are you doing to ensure that you're architecting a fulfilling and satisfying career? These are, I mean, the conversation is going to keep going, and I'm hoping that we've stirred emotion in you so that you can continue the dialogue with your teams, with your colleagues. And if you have any ideas, I invite you to reach out to myself or CPhA. I'm gonna hand it over to Kevin for the last word. This is an image that he shared, sort of like a vague cloud in the sky, but I'm gonna hand it over to him to give us a little bit more insight.
This is as cheesy as I get, guys. I'm going to read it. So this was a photo that was sent to me. I know it's not as prominent as the Northern Lights as it appears in other parts of Canada, but that's the point. It's vague. So I'll just read. The imagery here is powerful, and so is the description provided by the staff member of the New Brunswick Pharmacists Association. She described it. It looked like a vague cloud to the naked eye. So I thought that was interesting, vague cloud of energy. That's sort of what the Northern Lights are, magnetic energy. So the auroras, I looked this up. The auroras, or the Canadian Northern Lights, are results of disturbances in the magnetosphere caused by solar wind. I'm going somewhere with this. Major disturbances to solar wind patterns change the trajectory of charged particles. The resultant chaos of these particles is reorganized and emits lights of varying colors, which is beautiful to behold. It is pretty beautiful. Nature always teaches us. The metaphor here is powerful when we think about the unplanned chaos that has impacted the profession of pharmacy. We are not the same profession as prior to the pandemic, and that is not a bad thing. Similar to the particles that experienced an abrupt change in trajectory caused by a powerful solar storm, we, individual practitioners of the profession, have also experienced an upheaval. We are excited, we are charged with energy, we are full of diversity, uniqueness, and talent. In our struggle, we may seem vague in our current state. So we charge you on this panel tonight, light up our profession. Do this by resonating acts of caring each day for our patients, for ourselves, for each other. Speak out, practice with tenderness and caring, push forward with resilience. I guarantee you your efforts will be as wonderful as the Canadian Northern Lights. Aww.
Thank you so much, Kevin. I think that's a really beautiful analogy to close off our session for today. And I think it also just ties in so strongly with your, Shams, and Danielle's vulnerability in today's conversation. I think these are conversations that need to take place. I'm very honored for Zubin and I to have CPE as a venue to showcase the great work that's going on across Canada on this front, and to learn and be inspired from the three of you and the other pharmacy professionals in our workforce. So thank you very, very much from myself, the Center for Practice Excellence at the University of Toronto. We look forward to staying very connected, and especially as the next 2023 survey comes out, Danielle, I think those results will probably merit another follow-up session to this and a deeper conversation. For everyone online today, thank you so much for joining us, and thank you for being so engaged in the chat. I think it's wonderful to share resources and have conversations alongside the various threads of the conversation that Danielle guided us through today. Our next CPE speaker series will be taking place at the beginning of April, and will focus on disaster planning for pharmacies in the case of, the emerging environmental crises and other things going on in our world. So I think a topic that's very relevant to this conversation as well. Thank you so much, everyone, for joining, and take very, very good care.